So now we're going to follow a very similar concept. Right now what we're going to talk about is tibial fixation. Now I put a whole talk together just for tibial fixation. Once again, I want to thank DePuy Synthes Sports Medicine. I want to thank everybody in the room, everybody in the hall. I'm going to give you a nice hand of applause because y'all are amazing. You're making my stay fantastic. And I was a nervous wreck for today's surgery, and everybody was fantastic. So thank you so much. And then once again, thank you, Dr. Bonner. So we already talked about this in the last talk. This talk is specifically going to focus on tibial tunnel fixation. And the reason I'm putting a whole talk together for tibial tunnel fixation is it needs to be strong and will not fail early. And the reason is the most common cause of an early ACL failure is tibial tunnel fixation failure. So on today's, y'all didn't see it because we panned out, but I ended up fixing that graft in the tibia with a screw, aperture fixation, and then I put it over a knotless anchor as a post for a backup fixation because I did not want the tibia to fail. So I like to use the Interfix Advanced. I think if you have a four tendon hamstring, this is the strongest fixation on the market, and there's literature to support it. If you have to bundle the hamstring like we did today, you could either do your all inside, or you could do a screw and a knotless anchor. So why bio-composite screws? So the argument for metal, it's cheaper, it's easier, right? You don't have to tap, and it's never going to break. And they're never going to have a cyst or an adverse reaction to the metal unless they have some form of allergy. However, retained screws can make a subsequent surgery very difficult. And additionally, we always want to look out for the doc after us, right? You don't want to put her in danger, and God forbid it's you that's redoing it. You don't want to put yourself in danger, right? You don't want to make it more difficult than it has to be. So having a bio-composite, you can drill right through those screws. You don't have to worry about the difficulty of taking out a metal screw that might be covered by bone or stripped. So you never compromise your surgery, but you also got to be considerate of the next surgeon because the next surgeon may very well be you. So I think this is a great technique, and I have some videos here. This can go for both the femur or the tibia, a stacked screw configuration. This is a biomechanical study where what you do on a revision is you fill in the prior tunnel with the bio-composite screw, and then you drill your next tunnel around it. And the bio-composite screw acts as a wall. And I will tell you, screw-on-screw fixation is second to none. And it's an excellent technique, and this is a biomechanical study showing that its fixation is similar to a primary ACL fixation. So here's a video, courtesy of Dr. Bonner, right here in the femur. What you're going to see, it's a revision ACL. We're going to take out the metal screw here. And this is a very good technique for revision, to do a single-stage revision, as long as you don't have wide tunnels. Here goes the screw, putting it right back in the femoral tunnel. And then some people need guide wires. We're going to put the guide wire in, and we're going to drill our femoral tunnel. And you can see, give me 1 second, there's your wall. There's your wall from the screw. And so it's the superior wall of the tunnel. And he's going to get screw-on-screw fixation here when he puts in his Milagro screw to fix the bone plug right there. So can you do it in the tibia? Here we are in the tibia, taking out the metal screw. You can see the defect right there in the tibia. We're going to fill it with the Milagro screw, and then we're just going to drill our tibial tunnel wherever we want to put it. And there you can see the Milagro screw is filling in the void on our new tunnel, and you get screw-on-screw fixation. Additionally, someone who has an ACL tear, whoever tears their ACL, even if they get a reconstruction, they're 7 times more likely to get a total knee in the next 15 years. So don't make it more difficult on yourself or your colleagues by having to take out that metal screw. If they have bio-composite, they can just do a total knee like it's a primary total knee. So what about the comparisons between bioabsorbable and metal? And here's in hamstring, soft tissue. 2 and 5 year follow-up equivalent outcomes. No difference in fixation, no difference in strength. So what's the history? So in the 1990s, we first started. We started making these screws out of PLLA and PGA. The PLLA had a really long degradation process. The PGA was too quick. It absorbed so quickly the body couldn't remake bone, and we were getting cyst formation. The same company that makes fiber wire puts a lot of this in their screws. So in the late 90s and 2000s, they started making stereoisomers. PLA, PLGA. PLGA is a much more controlled resorption rate to allow for the body to create the bone, build the bone while it's being resorbed. And in 2004, Mytech came up with a more bioabsorbable polymer with an osteoconductive bioceramic. And that osteoconductive bioceramic is tricalcium phosphate. And the name of the implant was BioAcryl Rapide, which we all know as Milagro screw. So it's 30% tricalcium phosphate, it's 70% PLGA. This is osteoconductive. This is a controlled breakdown to build bone. So at 3 months, the screw is intact. At 10 months, it's absorption. 18 months, it's mostly absorbed, building bone. 24 months, completely filled with bone, compared to just PLLA. It resorbed too fast, right? It couldn't be resorbed. Or excuse me, that was PGA. PLA is very slow. And it promotes absorption at a controlled rate. So they're not all the same. And I'm not here to badmouth the other companies, right? A lot of companies got good products. But the Smith and Nephew Coaxial screw stimulated too much bone. And in the States, we're actually having lawsuits because of overgrowth of bone as a result of the screw. So why BioAcryl? Why Milagro? Why BioAcryl composite? It's the excellent track record. It's been around since 2004. We're almost going on 20 years. It has osteoconductive and a slow resorption process. I have 10 years of experience. I've never used any other screw. So maybe I'm a little biased. But I've never had an adverse reaction. I can't say that about many things in medicine. I've made plenty of mistakes, let me tell you, all right? But I can't, I mean, some of y'all saw them on my meniscus today. But I can't, I've never had an adverse experience with a Milagro screw. And I've never had to stage a revision because of Milagro screw, right? I've never had to say, oh my gosh, I can't do this ACL because this screw is making it difficult for me to do the ACL. So BioAcryl Rapide, the osteoconductive, the slow resorption, it promotes absorption at a controlled rate and a high osteoconductivity in the literature. What does it do? It buffers the breakdown of the PLGA, and it's also osteoconductive. So at the same time of making a controlled breakdown of the PLGA, it's stimulating the body to grow bone while the screw is being broken down. And there you are at 3 years. So the new screw has a wider pitch, Milagro Advanced. It's the same BioAcryl Rapide material, 30% tricalcium phosphate, 70% PLGA. It's wider thread, so it inserts with half the turns, less force, and maximal fixation strength, especially on the metaphyseal bone. So here you are, here's your Milagro Advanced, probably 900 newtons, and here's your Arthrex screw at 600 newtons. So it's 33% stronger and easier to put in. So it's a fantastic screw. So what about the sheath and screw? The sheath and screw is equivocal to the staple and screw. So, or the staple and screw. So I like the sheath and screw. It's bio-composite material again. It gets reabsorbed. The traditional method for a hamstring is staple and screw. But here's a study out of 2017 showing no difference in fixation for either. And in fact, over 15% of the patients that got staple and screw had to get the staple removed, whereas nobody with the sheath and screw had to get the sheath and screw removed. So why Milagro? There's no surprises. It has a great long-term track record. There's no changes. The screw goes right in. It fixes. It reabsorbs. It doesn't make it more difficult for you down the road. So in conclusion, we already went over all this. The Interfix Advanced with the Milagro screw is the safest and most consistent bio-composite on the market for tibial fixation. So bio-composite screws for femoral and tibial fixation have been shown to be safer and as strong, if not stronger, than traditional metal fixation. BioAcryl Rapide Milagro screw leads the market in ease of use, strength of fixation, safety for the patient, and most consistent and highest rate of osteoconductivity and controlled resorption. The Milagro screws, the stacked screws, are an excellent form of fixation for one-stage revision ACLs, both on the femur and on the tibia. And the Interfix Advanced sheath and screw is as strong as traditional staple and screw, but with a lower risk of additional surgery and higher patient-reported outcomes. Thank you.